Hopefully for those of you who are joining us, you're ready to have a good discussion about some of the things that Seth and Lauren were just talking about, ways that you can keep your brain sharp. And I'll just start off by saying something that I've learned, and I've had a chance to, I know some of our panelists, I've read about all of our panelists, but something Seth just said during his remarks, this idea that he didn't even know you could do anything to sort of to help take care of your brain. I think this idea that the brain is sort of this black box and, it's measured by its inputs and its outputs. You can't see it. It's encased in this hard skull of bone. And therefore you really couldn't change it or improve it, or, you got what you got and that was it. You drained the cache of neurons as you got older. And, we've learned a lot over the last couple of decades about what the brain is capable of doing, not just when the brain is still developing, when you're a baby, not just after an injury, but everyone's brain at any age. So I think that it's a fascinating sort of, and I think very inspiring, focus of learning that we've had around the brain over the last couple of decades. And I thought maybe that would be a good place to start. Welcome to all of you. Thank you for joining us, panel. It is a really tremendous panel. But Doctors Sherzai, maybe I'll start with you. First of all, just tell me about your field of specialty, how you got interested in Alzheimer's.
Well, thank you so much for having us. It's so wonderful to be here with the esteemed panel and being connected to these wonderful caregivers. Really excited to be here. I guess our story started about 17 years ago, about 8,000 miles away from here, back in Afghanistan, when we were working in the community. Dean was there working for, he was in NIH, and he was invited by the Health and Human Services and the World Bank to go there and build the community on and work on health policy. And I was there. I used to work with Doctors Without Borders, and I was working at a refugee camp, and we met at a party. And the first conversation we had was about our grandparents who were just devastated by this horrible disease, Alzheimer's, and how these incredible men, both of them highly educated, they were our heroes, and how we both saw them lose parts of themselves to this horrible disease. And that left a mark, and that essentially just set our trajectory to learn more about brain health, about Alzheimer's. We went into this field to find the treatment for it. And so we trained in, one of the best places. We went to UCSD back then. Dr. Leon Thal was doing some really critical work on Alzheimer's disease. We worked on neuroimaging, on molecular research, but we quickly realized that there needs to be more. And so we ended up working in the community in public health. Back then, our mentor, Dr. Elizabeth Barrett Connor, was doing some really fantastic work on prevention of cardiovascular disease in the community. And we found out that there is a lot that can be done for brain health as well. So we both went to Loma Linda University, which is a blue zone, and Dean established the Memory and Aging Center there. And I did the first one of its kind. And I think you and I coined the term preventive neurology. So that was our specialty. And I did a dual residency in preventive medicine and neurology. I went to Columbia University, did a fellowship in vascular neurology, understanding the importance of lifestyle on brain health in general. And now we're conducting research and working in the community. Our research, one of the largest one in the community, is at Beach Cities, which is in Manhattan, Redondo, and Hermosa Beach in Southern California. And we're looking at the application of lifestyle in the community and seeing its effect. So
the importance of lifestyle has been known for all other systems. And for some reason, we think that this black box, the brain, 3 pounds, 2%, 25% of body's energy, is a separate entity that came from space into this little vault, and it's different. It's not. It's all the other systems maximized to its nth power. The amount of energy, the amount of stress, the amount of production and elimination of products, and it's all magnified when it comes to the brain. And the same things that we've applied to prevention is exponential on the brain. And we've known this, and you've known this, Dr. Gupta and all this amazing panel. The key is to translate it into the communities now. And that's what we're doing in the communities, in the faith-based movement that we've started, and the beach cities and the community side, of how to empower individuals, how to take policy, which I love the concept of policy that was the beginning of my work, how to take policy and implement it to the person. And that's what we need to do to stave off this most devastating, the most expensive, and in the next 20 years, probably the most debilitating disease to our entire system.
What a story you two have had. I mean, I actually knew your story somewhat, but that's incredible. I feel like I have so many questions. I love the fact that you met at a party and that it started you on this journey. But you
Dr. Gupta, she sat next to me.
Is that right? I like how you threw that in there.
I'll tell you the entire true version some other time.
Okay, well, you can write a book about it, right? Dr. Drew, what a pleasure, Dr. Ramsey. Just building on the same sort of stuff that you're hearing from Dr. Sherzai. What is it about brain health that you think the average person should know? And I mean, I think oftentimes we think of health and you think of working out and getting muscles and improving now, but the idea that you could improve your brain now and help ward off disease as well later. I mean, sometimes we think of these as two different things, but what have you learned?
Well, thank you, Sanjay, and hi to everyone. I'm really just honored to be on the panel with so many of you, especially as a psychiatrist. We've known for a long time, we've had a horrible mental health epidemic in this country, and increasingly we now understand mental health means brain health. And so what I've really been focused on in my work is how do we incorporate nutrition into mental health? How do we make some of the changes that Dr. Sherzai are talking about and that Dr. Annie Fenn's going to tell you about? And how can we utilize that in mental health? It's really surprising when you're a psychiatrist like me, there's really no education around nutrition, which is surprising. As Dr. Sherzai said, the brain burns more fuel than any other organ. We now know that the risk of depression is highly correlated with what you eat. And we know that your risk of depression can up to double your risk of Alzheimer's disease or dementia. And so my hope is really that, and I guess what I've learned to your question, Dr. Gupta, is how much we can do and how much more we need to do to empower our patients, that we need to move away, I think, from fear-based messaging. And what my work has really been about is putting joyfulness back in nourishment, that food is one of the oldest pleasures that humans know, one of our most primal pleasures. And when we can really focus on the brain foods, those foods that have the nutrients we know can ward off depression, that can likely ward off dementia, that certainly play a role in regulating inflammation, when we can feed the microbiome, when we can incorporate that into mental health and brain health treatments, I think we're winning the fight. And I think it's been a really big missing piece that as we focused on the epidemic of obesity and diabetes and diabesity, as we call it, and cancer, all really important diseases, we've got to make that connection. What you eat influences your level of depression, anxiety, your stress response, and your risk of dementia. And I guess what I've learned is that people are excited about this. I think Seth Rogen's been in the dark a little bit. I think a lot of us have heard that message that you can do things to impact your brain health. And so that what I've learned is there's just a wave of enthusiasm that's happening in the country about food and about mental health. And it has me really, really excited.
We're going to dive into some specifics because I think there's a lot of people who are listening that they want to know, what does this tangibly mean for them in terms of how they live their lives. But I'm curious, Dr. Drew, it's interesting. And I should call you Dr. Ramsey. I don't know why I'm calling you Dr. Drew.
You can call me Dr. He made his name before I did. I'm just hoping to walk into those shoes.
Okay. Well, be careful what you wish for. You have a healthy heart, and you could say, okay, it has a certain ejection fraction, or it doesn't have plaques in the blood vessels that lead to the heart. How do you define a healthy brain?
I define a healthy brain when it's sitting in front of me, as it's operating, as we say in medicine, at the top of its license. The best functioning of a human brain is when it's connecting us up to our own passions, our own goals and dreams, when it connects us up to those in our community and our loved ones. You see healthy brains are smiling, are connecting, are optimistic, are creative. Those are the signs of mental health. And what I like about that definition, and maybe that's the most traditional, is it allows us to have some symptoms. It allows us to struggle with the pandemic and to be really sad and to grieve in a normal way. It allows us to be anxious about our health and to not pathologize all the symptoms as things we've got to get rid of, but oftentimes it's things that we can work through or understand. And so I think it's really, it's our hope that increasingly we think about mental health as something, not that 20% of us have mental illness. I'm done with that statistic, Sanjay. I want to think about that 100% of us have this gift, this miracle in the universe, a human brain, and we all should know how to feed it. We should all know how to care for it. And in doing that, I think that we do a lot to stave off dementia, depression, anxiety, and we get to operate at the top of our license and really enjoy being humans.
I think that's really, really good. You know, there's this, one of my favorite books I've ever read is a book called Why Zebras Don't Get Ulcers. It's by Robert Sapolsky. He's an evolutionary biologist. And I was talking to him because I was so fascinated by the book. The title sort of gives it away in terms of what the book's about. But I asked him about a healthy brain, Dr. Ramsey, and he said an interesting thing. He said, a healthy brain is a brain that has a wider circle of us, is how he sort of defined it. The more people that you sort of include in the circle of us. And I guess that's empathy, it's connection, it's a lot of the things that you're talking about that would widen that circle of us. So we'll come back to that in a little bit, but Dr. Pamela Price, I apologize, I don't have the monitor, so I'm assuming you're there.
She's here.
Okay.
I'm here.
You know, I thank you for being here. I was excited to speak to you and hear from you. And, you know, one of the things that we think about a lot with brain health is the idea that it does require a multidisciplinary approach. You know, you talk about nourishing your body, you talk about the right kind of movement, all those things, but the role of faith, the role of spirituality. I wonder, first of all, maybe a little bit of how you became interested in this and what can we learn?
Absolutely. So first of all, yeah, I agree. I'm really just honored to be here with this panel, and I'm learning, laughing, and really just enjoying being here with everyone. My journey kind of to this space, it really began as a kid. I mean, I grew up like, you know, a lot of people that I know, you know, come from low-income background. So a lot of the people that are in the communities that we want to reach now are ones like I grew up in. And despite, you know, nursing school and, you know, having a really extensive background in healthcare, it really wasn't until Alzheimer's hit home that I started to try and learn more about this amazing brain that we have and how we, yes, definitely should work to take better care of it. And so in that kind of evolution, in that learning process, I came to work with the Baum and Gilead, where I am the deputy director. And 5 years ago, almost 6 years ago now, our CEO, she's the epitome of little ideas. And we wanted to create a center that really could focus on all the aspects of brain health and have it focused on what do we need African Americans to do, but it's all pinned under this umbrella of faith and spirituality. We know that, you know, we listen and perk up when our bishops and our pastors speak, but we also know that during challenging times, during hard times, we lean on that. Sometimes that's the only thing we may have to lean on is our faith and the things that we, you know, the higher powers that we believe in. And so we wanted to harness that in a way and connect messaging to it. I really loved what you just said, Dr. Ramsey, and that definition of what a healthy brain looks like, because it is about connection. It is about, I think, demystifying, destigmatizing mental health, stigmatizing even Alzheimer's and dementia, and just really those of us that are caregivers, what we experience in this space. And people, you know, it's the whoa, 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 and the woo, woo, woo. And yes, it's hard and it's challenging, but we don't want a pity party around it. We really, again, we want to connect with people. And if we want to laugh, we want to laugh. If we want to cry, we want to cry. And we want to learn from each other about how we are getting through this journey as caregivers. And so our center is focused on that, but we also reach out to healthcare providers. We work with academic institutions because the same audience we're speaking to, they are the ones who have high rates of obesity, and they are the face of high blood pressure and hypertension, and you name it, they got it, sometimes in multiple ways. And so, you know, for us, it's saying, hey, look, we know you have all these things, but as we're talking about today, we can do something. We're not powerless. You know, we don't have to just live with, you know, this fear of getting dementia later on. We don't have to live with this fear of just being unhealthy. and learning being our authentic selves and everything that comes with that and the beauty and all of that, and really just trying to connect and educate people as best we can.
That's terrific. Thank you. And we will come back to that point as well. I'm going to go around because I want to hear from everybody, and then I'm going to sort of hopefully have this discussion. But Dr. Fenn, you know, is it the Brain Health Kitchen? Is that the name of it?
Yes.
I just
Yes.
love that idea, the Brain Health Kitchen. I'm wondering if you could just tell us a little bit about your background, and also, you know, these tangibles. You have the Brain Health Kitchen. I want to know what's inside of it. What are you cooking?
I'm cooking a lot of things that we'll be talking about. Well, my path is a little bit different. And first of all, thank you, HFC, for having me. And, you know, many of the people on the screen here are my mentors in the brain food world. So it's nice to see you all. But about 15 years ago, I was practicing as an obstetrician gynecologist with a focus on menopause. And every day I would have a patient come in and say, Annie, I think I'm getting early Alzheimer's. And of all the menopausal symptoms my patients were bothered by, it was cognitive changes that bothered them the most. And I started to notice that my patients who had less of these cognitive symptoms actually were following a more healthy dietary pattern. So fast forward a bunch of years, I was taking a break from medicine and I went to culinary school, and I came back and was teaching as a culinary instructor in my community, basically just trying to help people eat better. I had realized that a lot of the diseases that I had been trained to treat were actually could be avoided if people would just change their lifestyle. So I was doing this, and as Pamela put it, Alzheimer's struck home. So this was in 2015, and my mother was diagnosed with mild cognitive impairment, which is the earliest stage of Alzheimer's. And I dove into the literature. The Mind Diet had just come out. I put together a meal plan for my mother based on these guidelines for my brother, who moved in with her 6 years ago and is still her primary caregiver. And it was then that I came up with the idea that I should use my medical background, my culinary training, and basically my passion for sharing food to help people eat better to prevent Alzheimer's. Because the data really does support that certain foods are neuroprotective. And if we just get the word out about that, then we can fend off a lot of the age-related cognitive decline. So in 2015, I started the cooking school, Brain Health Kitchen. And I've been traveling all over the world ever since, teaching people how to eat better and cook with these neuroprotective foods.
Is there, you know, I think the adage you often hear is what is good for the heart is good for the brain. Are there specific things that, you know, I always am reluctant to use the term superfoods because I think that conjures up sort of these magical cures or whatever, but are there specific foods to the brain? Lauren in her opening was just mentioning berries, which I've heard a lot about as well. What have you found?
Absolutely. So I draw on all of the data that's basically built on the many years of studies we have on the Mediterranean diet. And when the Mind Diet came out from Rush University in 2015, they described 10 brain healthy food groups. And they chose these food groups because they individually had studies to back them up, that they could protect memory or slow down cognitive decline in some other way. And so every single food group in the Mind Diet is a spin-off of Mediterranean foods that are specifically brain healthy. So berries is really the only fruit in the Mind Diet guidelines. So when I teach in my cooking school, I teach a lot from these 10 brain healthy food groups. I found it a very teachable way to show people the best ways to eat. The top 4 brain healthy food groups from the Mind Diet group include berries, leafy greens, vegetables, whole grains, and olive oil. And these are foods that I call them everyday foods. These are foods we should be eating every day. And every time we choose to eat one of these brain healthy foods over something that's not so brain healthy, because there's a list of those too, then we're reducing our risk of Alzheimer's every single time we make a choice.
And again, this is a topic we'll come back to, but just quickly, how hard is it to arrive at some of these conclusions about diet and something that is brain healthy? Is this more mechanistic, like this is a food that has a certain physiological sort of impact on the body, or is it following people who eat a certain way and seeing what their cognitive health is like over time? How are some of these conclusions drawn?
Well, there's lots of different layers of the scientific data. You know, we do look at epidemiological studies, looking at what do people eat that actually do well, they live long and dementia free. such as the people that live in blue zones. People are living to be 100 or more in the 5 blue zones around the world, and they don't have dementia either. So we like to look at populations of people, what they eat. We also like to look at basic science data that starts with animal studies and then gets applied to groups of people, such as in the Nurses Health Study, they looked at berries and how many servings of berries did these women eat over 16, 20 years? And then how do they perform on memory testing? So we've had very specific data that points to these foods as being neuroprotective.
I think this is so important because, there's lots of things. I guess people often say, absence of evidence is not evidence of absence, but there is data behind some of these things. And I think it's always important to share because it's that much more substantive. I know, Alexandra, welcome. I know you are a big proponent of data as well. I now have a monitor, by the way, judging by the background behind you, which is complicated and looks really impressive. I got to ask about that. But one of the things I think that doesn't get talked about enough, whether it's in the middle of a pandemic or dealing with, the dementia, the population of people with dementia is unpaid caregiving. And it's really remarkable to me. I did work on this book that Lauren mentioned called Keep Sharp. And as I was interviewing people around the country for this, it always came up, this idea that there is so much caregiving that goes on. It's challenging, it's stressful, it's unpaid. What have you learned? What has the data shown you?
Okay, first of all, I'm got to be a super dork, and I so fangirl over you. And I love that your other books, by the way, were Cheating Death and Chasing Life, and that I know you're starting Life Itself. I'm so excited. And you'll see right over my head, it says Health is Life.
There you go.
Couldn't agree with you more on that concept. And I also, your dedication, which is so important for all of us, always take the time to be completely present, because it is perhaps the best and most joyous way to keep your mind sharp and your life bright. And that is so important for caregivers. So any unpaid caregiver listening, and we know the data shows about 2/3 of you right now are in an unpaid caregiver situation. So I'm gonna talk about the impact of COVID on mental health. And I believe in being positive too. I'm an insanely positive person. I'm gonna start with some data that's hard, because I think when we're asking people to make investments in supporting unpaid caregivers, we gotta talk about this reality and acknowledge the reality. And I find often when we share this data, it helps people who are struggling in this role feel less alone. And we know one of the most important lines of treatment is that somebody feels less alone in their reality. So before COVID, caregiving was already hurting us. So we know that if you were a caregiver, you had twice the risk of depression and twice the rate of coming down with a chronic condition, a full 26% level of poorer health. And we saw that there was a lot of high flyers. So caregivers, because they don't have time to go to see the doctor, to go see you on a preventive basis, they were actually going after the fact in an urgent care basis. But we published some data with the CDC that looked at the impact of COVID on mental health. And Dr. Drew, I love this quote you just said, mental health means brain health. And so I want to talk a little bit about the impact of COVID on mental health. So specifically, 56% of unpaid caregivers have clinically significant anxiety or depression. And how do you cope if you're anxious or depressed? I will admit, this is something I absolutely sometimes do. Substance use. And unpaid caregivers are increasing their rate of substance use by 5 times the rate. Wow. And the ultimate manifestation of mental health not going well for you is suicidal ideation. And a full 1 in 3 unpaid caregivers in the month of June, when we did our survey before it was published by the CDC, 1 in 3 unpaid caregivers had suicidal ideation. And that was in June. So really important call to action. If you know an unpaid caregiver, you got to be loving on them all the time. So what do we do, right? Data is important, but how do you translate that data to action and impact? So I'm obsessed with your book again. So we look at this through the lens of what we call caregiver intensity. And what drives intensity is really similar to what drives brain health. So I'm like devouring your book and getting smarter and smarter. And you make the point that healthcare has been reactive, right? That we are reactive, and that brain health requires being proactive. And that is 100% true for caregiving. So caregiving intensity, which is the metric that we use for measuring impact, can be mitigated if we're proactive about it. And there are things that you can do more of, and we call these buffers, and they create resiliency. Your story about the community in the Netherlands, and you focus on what residents can do versus not do. This is true with caregivers as well. So I just want to share one most important buffer for caregivers is feeling connection. And Pamela, everyone's talked about this in some way already. And so for a caregiver, if you feel supported, even by one person, 40% reduction in stress, in depression, 30% reduction in anxiety. And so the most important thing any of us can do is we need to have our red phone, right? So if you're an unpaid caregiver, figure out the person that you can call no matter what, and they're going to love on you and be there for you. And then there's this other thing, we learned it from Susanna Fox, called ring theory, which is really important for unpaid caregivers. And the data specifically on ring theory is, I'll give Susan Silk. And the notion of ring theory, and all of us need to do this, is you're a caregiver for someone. That person you're caring for is in the center. Your job as the unpaid caregiver is to pour love in, no matter what, judgment-free, just love on them. But then that's really stressful. So you need to dump the crap out. So you need an outer ring. That's your red phone, right? We would call that your archangel. But then that outer person, they got to pour love on you, but then that's stressful. So they need to, dump some crap out. So I think it's really important for all of us, find your red phone, figure out how that is, understand where you are in that ring, be pouring love in, and have someone you can dump the harder bits out to. And sleep.
Sleep. I really love that. I think anybody who's hearing what you're saying probably immediately contextualizes this in their own life in some way, because I think there's a lot of universal lessons in that. Doctors Shirzai, and I feel like you guys will speak in unison, but how do you talked about the importance of thinking about this from a policy perspective, having I'm sure the data that Alexandra is talking about is really important if you're trying to make policy-based recommendations. How do you collect evidence around this? Again, I think we can all agree on the things that we're saying here, and probably have our own anecdotal sort of experience with these things ourselves, our families, whatever. But how do you provide the data?
So the research is extremely important. If there's no data, there's no direction, there's no policy. So we have to have data. But where I think we're missing the point is everybody thinks that the only data that means anything is randomized clinical trials. Okay. And it's not. You can't do a lot of studies with RCTs. And RCTs that are 6 months duration or even a year duration mean nothing when it comes to cognition. I can smile at somebody for 6 months, and no, actually, let me reverse that. If she smiles at somebody, they're going to get better. If I smile, they'll get worse. But 6-month RCTs mean nothing. So we have to look at the whole breadth. I mean, we just did 2 reviews, massive reviews on omega-3 and the developing brain and omega-3 and the aging brain. Even those reviews in their own context is not enough. So you have to look at the whole breadth. And when you look at the whole breadth of data, repeatedly, we know what works. We talk about nutrition, 53% reduction in one study, but if you look at the whole spectrum, it comes around 40 to 50% reduction of dementias, specifically Alzheimer's and vascular dementia, especially vascular dementia. When you look at exercise from the Harvard study, 45% reduction from a brisk walk. I mean, that's empowering. You don't have to do the marathon. I haven't done a marathon yet, and that reduces the risk. Now, here's the thing. The way you collect data, the arbitrary way we used to collect data was a survey that was created in white men in Boston, applied to 70-year-old Hispanic women in San Bernardino. That means nothing. You have to go to the communities. You have to connect to the communities. You have to even create the surveys. My PhD thesis was on this, which is CBPR, community-based participatory research, where you involve the community even in the data collection. And then you have a meaningful data that's not only collected from the data, but then can be applied back on the community, which means what? Research has to move. Before I move to the next statement, we are very pro-molecular research. I was at experimental therapeutics branch at NIH. It doesn't get any more wonky than that. It's important. Columbia University, important. But from 100%, we should go to 20%, and 80% should be prevention research, data capture, not in the lab with white coats, but with t-shirts in the community. And that's where the data means something. That's where the applications mean something. That's why what we do in Beach Cities, which is the largest brain health initiative and research project, is literally conversations with individuals. And after about a few months, the individuals who are in the research become researchers in a way. I think that's where the policy and evolution of research has to go, and will be most effective. Beautifully stated with the churches and the faith-based communities. When we looked at the different communities, the African American community, if you approached that population in the clinic, it means nothing. Actually, for me, it means nothing. If you go into the churches, into the hair salons, into the community, literally 200% greater connection, both as far as what the data means and as far as application of the data.
Absolutely.
How much of NIH funding? I was at an NIA and INDS. How much of the funding is in that direction? Nothing. Absolutely nothing. So that's where the shift has to happen. And that's where our passion is.
I want to read some of these comments that are coming in as well. This is from Laurel Ackerson to all the panelists and to Alexander Drain, everyone mentioning sleep. Such a challenge, she writes, for caregivers, possibly the biggest challenge. Some of us are not able to keep a sleepy health regimen, it sounds like, simply based on the caregiver's schedule as a result of the aging person and their own poor sleep schedules, thus interrupting the caregiver quality sleep. I think this is what the point is they're making. It's important. I think Laurel recognizes the importance of that, Alexandra, but it's just challenging, and you get into this unavoidable cycle of lack of sleep and other challenges for the caregiver. I mean, Alexandra, it's true, right? I mean, we know oftentimes what to do, but to actually be able to do it, to incorporate it into your life, is also a big challenge.
Yeah. I mean, I think one of the most important things to do for an unpaid caregiver is forgive yourself. And, it's okay that you're just not always going to be able to sleep. I think another thing is accept help. And we talk about the things that you're talking about that are protective. We think of as respite in the caregiver space. If you tell an unpaid caregiver you need some respite, they want to stab you because they're like, yeah, I'd love some respite. That's a great idea. Look at my life and how am I possibly going to do that? And one of the points that you make in your book, we say all the time, which is sometimes respite is just 5 minutes. What if you could give yourself 5 minutes to just chillax, right? Just go and scream in a corner, whatever you need to do, even if it's just 5 minutes. Now, ideally, is there someone in your community who's been saying to you over and over again, how can I help? Right? First of all, to anybody supporting a caregiver, do not ask how I can help. How can I help? Just help. Just put your body there. But if someone is asking you that question, see if someone will come to a sleepover, right? And say, can you just come? My mom's a wanderer. Can you just come sleep over tonight? I would just like one night of unfettered sleep. So I think allow people to care for you where sleep is concerned. If it's physically possible, I know often it's not, but if it is physically possible, ask a bestie to come to a sleepover and give yourself one good night of sleep. And otherwise, 5-minute cat naps where you can.
Again, such great advice. I'm living during this COVID time with 3 teen girls. These are my daughters, and I mean, I guess I'm not trying to minimize caregiver. I am sort of a caregiver, but it's funny, just do stuff, right? As opposed to having the discussion around it sometimes makes all the difference. It makes a big difference in terms of how they perceive what I'm trying to do and all of that. Dr. Ramsey, we understand the value of sleep. Again, just building on this, because it keeps coming up in all these discussions about some of the best things you can do for your brain. And again, we know this, but what is it about sleep that you've learned, Dr. Ramsey, that is so beneficial when it comes to your brain and your mind overall?
I think about sleep as the wash and rinse cycle of the brain. And I guess I also want to tell everyone listening, I'm also a caregiver. Both my parents are in their 80s and are putting up a good fight, but struggling. And so I just wanted to acknowledge Alexandra's comment. I think forgiving yourself is really important. I've been in emotional states, angry, frustrated, not patient. And I've had to forgive myself in some ways to kind of, I guess, look in the mirror the next day and just decide I'm going to do a better job taking care of them. And so I just think that's a huge part. In terms of sleep, what happens, sleep is really one of those vital signs in mental health that I mean, seeing patients every day, I saw a guy yesterday that hadn't slept, college student at all. We just rescheduled because there's just not an accurate signal. Without sleep, it's nearly impossible to keep good reality testing in terms of a sense of balancing your emotions, a sense of understanding where they're coming from. Certainly, I think I'm most depressed after I haven't slept. It's one of those almost, for me, universal things where I'll I'll be pretty in a dark spot and just go to bed. And it's kind of like a miracle sometimes. I think that's where so many caregivers commenting are talking about the difficulty sleeping. And I think for me, one rumor is, or one sort of tip is getting away from, I started monitoring my sleep. Actually the middle of last year when I was maybe struggling a bit. And I noticed, but getting 8 hours of sleep is probably nearly impossible for most Americans. To get 8 hours of sleep, you need to go to bed at about 9, especially if you're a parent where you start waking up at 6 a.m. no matter what, right? Once you're a parent, it's like you just can't sleep past it. We're an adult probably. And then looking for the things that disturb your
We're
sleep.
like all crying with laughter right now that you just said that. Like,
Right. Well, I just think it's good for us to be honest. As I've been monitoring my sleep for a month, I think there's only a couple times where I've had a solid 8 hours. That said, the more you monitor things, the more you can manage in them. And that's where I think there's so many tools at our disposal now where we can understand how exercise influences sleep. Growing up on a farm, you never had a problem sleeping because you woke up with the sunrise, you worked all day, and you got into bed real tired. That's always kind of stayed with me. And I guess additionally, Sanjay, something I see and the other physicians see is there's a lot of use of sleep medications. Sometimes those are great, but a lot of times those are a Band-Aid. And I just want to point out, sometimes we need Band-Aids. If you haven't had a good night's sleep and you need a little melatonin or a little sleepy time tea, or maybe something stronger to get a good night's sleep, what's important is sleep. And I think people having a toolbox around how to take care of their sleep, how to promote sleep hygiene, and then a good, what I call launch sequence. Like, don't get in bed and close your eyes. Like, that's not how you fall asleep. I mean, it is, but you want to set yourself up, dim your lights, kind of center down, read something that's not a screen, do some deep breathing, maybe make a gratitude list. Those are all ways you can promote better sleep.
You know, I think it's so important when we talk about healthy behaviors, Dr. Ramsey. You know, we oftentimes talk about in the context of prevention, do these things and it'll help prevent disease later on. But the idea that it feels good now, just like you said, I think is so critically important. It closes the loop for people in terms of inspiring good behaviors. I'm the same way. I feel fantastic when I've had a good night's sleep, and it's so rare. I mean, I've been so head down in COVID for the last year. I mean, waking up super early, talking to people on the other side of the world, going to bed late. I am not a good patient right now, but I do recognize exactly what you're saying, the value of the sleep, and I feel fantastic. You know, one of the other things, Pamela Price, that comes up a lot, and you alluded to this, is, you know, the connection is protection. And spirituality, faith-based organizations, when you talk about the impact of being a member of one of these organizations or being involved, it's good for your brain, good for your mind. But why is it specifically? Is it that you're part of something larger than yourself? Is it that you are connecting with people in a different way? Maybe there's not a direct answer, but I'm just wondering your thoughts.
So yeah, and I think it's a combination of those things. I think it's a little bit of what Alexandra said in terms of a person at your church is your red phone. We often talk a lot about Sister Mary's. Sister Mary is just that one lady in the church. She knows everybody. She's been there since the church began. She'll be there when the church is no longer there. And so knowing that they become such a really great and trusted, I think a really key word is trusted. Our churches, our congregations, the people in them are trusted. And in a time, especially like what we've been experiencing with COVID-19, we've got to lean on those kind of trusted resources even more. And they become not just support centers for our mental health and well-being, they become support centers just for, like Dr. Scherzer was saying, of where we get resources, where we get information, but also of how we connect. I really love the idea of individuals realizing, as you said, you can touch more people on a Sunday morning or a Wednesday Bible study than you can in terms of waiting for them to come to a clinic, waiting for them to actually talk to their healthcare provider, if they have one. Getting this community to see a Dr. Ramsey, a psychologist, not highly likely. But having a Dr. Ramsey come and sit and talk with one of the deacons, and the deacon say, hey, look, Dr. Ramsey is going to help us get our brains healthy. Dr. Ramsey is going to help us talk about how we can rest better, sleep better. They become trusted partners that tear down a lot of the barriers, whether that's even with food and nutrition. Our churches have community gardens. So there are places where you can get those berries and those green leafy vegetables that you can't get in your neighborhood because you live in a food desert. So for us, that connectedness is a very much a holistic connectedness. But it also does give us that sense of whether it's Allah, Buddha, you know, and the Balm and Gilead, we are not a specific faith or denomination. So whatever form Jesus, God, or whoever comes in, we're prepared to, you know, I think, again, just connect with people to say that's great and help them identify how they can use that, how they can help, whether it's changing of the mindset, whether it's changing of saying, hey, I really want to do better about eating. I really want to do better about trying to manage my rest sleep cycles. And I want to be able to give myself permission to get help. As a caregiver, I think it's just extremely hard to give ourselves permission, to give ourselves the grace that we need. We're spreading it out to everyone else, and we often just don't give ourselves that same level of grace to say, hey, look, you know, I screwed that up royally. You know, tomorrow is a new day, and I'll try to be better. And our faith, for most of us, allows us to do that because it's about forgiveness. It's about love. It's about healing. It's about faith. Is about hope. I don't care, you know, kind of where it is. It's all about hope, that there's something else beyond this life. It's something else beyond this moment, beyond this time. And that's powerful, especially you just where we are in the world right now, and where we are again on these, you know, journeys as caregivers. That's powerful. I've cried. I've had, you know, I found my little 15 minutes to just sit in the bathroom with no kids knocking at the door and just said, hey, what, you know, and just allow myself to connect to whatever's happening in that moment. And we encourage, you know, folks to really seek ways to do that.
That's beautiful. I feel better just listening to you a little bit. I want to finish in a second here with Dr. Fenn, but Pamela, you know, I'm curious, during this COVID time, we're all sitting here talking on this Zoom call. I actually find it's pretty good. I mean, I wish I was there with you in person, but it's not bad. But with regard to some of the things you're talking about, how difficult has it been during this time when we're mostly staying at home and doing things over the computer? Are people still able to make these connections that you're talking about?
They have, but it's in a different way. In addition to I work with our Brain Health Center, we also were doing diabetes prevention programs, and they were literally housed inside of churches. And so our lifestyle coaches, our managers, our coordinators, when COVID came, they were crushed, because one of the reasons that our participants reported that they were successful in dropping their weight and getting more active is because they came to this church and connected with the group that they were working with on this year-long lifestyle change program. So we were very fearful that once we had to make adjustments, that people would feel disconnected. But what we realized is that because we had tapped into people from those communities, our participants they still felt comfortable. And once we had technology gaps and hurdles, we had to teach a lot of Zoom, a lot of click here, a lot of tutorials. But we realized that because we built this out of the, long as we provided those Zooms, and I've hopped in on several of the classes, they are laughing, they are enjoying. When George Floyd happened, we actually had a group that in that moment, that story broke. And it was powerful what that group discussed, which was totally off key from diabetes. But I think it's the message. And I think whether, as much as we would love to touch and hug and feel, I think seeing faces, seeing people nod, seeing people smile, clap, through our screens was still a way that we could get connected. Our pastors are doing virtual Sunday services and Sunday Bible studies now. And so a year later, they're Zoom pros. And and so we're going to continue actually to offer certain things virtually, even when we can return to in-person But so I think it's all about,
Yeah.
it's your message, the message and the messenger. And if you can get those two things right, you can connect, across airwaves, Zoom, you name it.
Okay, that's great. It's reassuring. I mean, I do think we're gonna come out of this time at some point, this COVID time, but I think these connections are still important, obviously, even as we're still living this life. Dr. Fenn, let me just finish with you. We're already sort of a little bit out of time, but what you've been on this journey. You're a doctor. You've got this beautiful looking kitchen behind you. I'm seeing in the monitor. What people want to know a tangible. You talked about some of the specific foods, but what about your life? How do you live your life differently now than maybe when you were grinding away during residency and things like that to do things for your brain?
Well, I'm certainly recovering from all the sleep deprivation I went through from delivering all those babies back in the day. And it's not easy, but sleep, as we've talked about, is paramount. The other thing that I want you to know, caregivers, that's so important is I want you to be able to cook healthy food. I want to make it easy for you. So what the bulk of my work now is to provide resources so that you can put together brain healthy meals, because I know you don't have a lot of time to cook.